All right, it looks like we've got everyone out of the waiting room, and I've got about two past the hour, so we'll get underway out of respect for time. This is a webinar that's being presented on behalf of the Stender School of Leadership, Business, and Professional Studies. Today, we're fortunate to have Dr. David Marc from the Department of Health Informatics and Information Management presenting on how you can use public data sources. Know that this will be good information. The session is being recorded, and you should get a follow-up message with some information regarding it and a link to the recording from our admissions counselor, Joe Jankar. If you're interested in what you're learning here or want to share the good word about what we're doing, we've got a number of programs at both the bachelor's and master's level, including certificates that relate to the health informatics and information management program. So without further ado, I'll turn it over to Dr. Marc, and I believe that he'll leave some time for questions at the end. Otherwise, feel free to type them into the chat during his presentation.
All right, thank you, Eric, and thank you everyone for being here today. I'm happy to be presenting on this topic that I'm sure many of you share the same passion for public data as I do. So this should be a thrilling topic to be sharing with you because it is something that is near and dear to my passion. Okay, just a little bit about me. I'm not going to read this off, but Eric provided a nice introduction. If you want to read more about who I am, you can read what's in my bio here. But I'd like to get into it. So the purpose of the webinar today is to really examine the current state of public data and access to that data and explore some data sources that are available for discovery and analysis, and also illustrate the utility of public data for business intelligence and research purposes. Today data is largely stored digitally. We don't have a lot of documents sitting around necessarily any longer, at least none that we are using widely, that are just in print. We're often accessing that data digitally. And the data can be encoded in many different ways. Thinking about how you access data on your computer, you might be working with a spreadsheet. You might be working with that data in many different types of formats on that spreadsheet, but it's going to be encoded in some way that allows the computer to basically interpret the data in a human readable way. So it could be encoded in UTF-8, ASCII, JPEG, MPEG. Those are all data encoding methods. And they encode data, and data takes many different forms, not just a traditional like spreadsheet is what we think of, when we have rows and columns, but there's also data that can be multimedia. So pictures, videos, audio files, that's also considered data. Text that's accessed online is data or in a computer. And data can be stored locally, where it's on your computer, stored on your hard drive, or it can be in the cloud, where it's stored on servers that are, managed by organizations that house the data in oftentimes these server farms that are located really anywhere in the world. And then you access that data through the internet. The data can be formatted in a variety of ways depending on the type. So you have CSV data, Excel data, you have DAT data, XML formats. There's many formats that data can take. And again, nowadays, a lot of that data can be accessed remotely through in connection to the internet. The internet has created a data revolution. A lot of data is collected and storage is now cheap. And that data, and how we store data online, it's not centralized. There's no one that really is in charge of managing that data, organizing that data in a way that allows it to be accessed and used. Most people have access to the internet, however, and that's paving the way for more initiatives around data sharing. So think about it. Think about how we share data in our day-to-day work. We share it in email, where we might be providing documents or access to different spreadsheets, online storage drives. So you might be storing some data in whatever format that might be, whether it's pictures, text files, it could be spreadsheets, it could be any multimedia, where we're sharing that online and making it available to people that we allow to have access to that, either by sharing a link or giving them access to specific files. Social media, we're sharing a lot of content on social media, whether, predominantly multimedia, but also information about our thoughts, perspectives, feelings. Streaming platforms, we share data with them regarding what our preferences are for content that we view. Journals and libraries, we share data with, gaining access to documents, online shopping and review of products. So when we buy an item online, that stores data about our buying preferences, maybe even looking at our history of how we have discovered that product, or any information we're sharing about our feedback about that product could be, that's another example of data sharing. And really making data available and has a lot of benefits. So a lot of that data in terms of data sharing procedures and practices, it's driven by these overarching benefits to that data being just available. So transparency being one. If you think about data that's published by governments, the main intent behind publishing and making that data available to the citizens is to ensure greater citizen participation in government affairs, and also giving the public more awareness regarding government activities. So that is one important area around transparency. Public service improvement, so offering citizens the raw materials that are needed to engage with their communities to improve public services, whether that's in your local communities where you're trying to create initiatives that are intended to have some intended benefit to serve that population and the needs of that population. Or it could be more of a broader, more base population. It could be citizens within a country or even within the world that trying to drive meaning and find where there are opportunities for delivering on a particular need within that a larger population. Innovation and economic value, so supporting the design of new technologies and services and data-driven products. We hear a lot about large language models and AI. A lot of the basis of those large language models in terms of how they were trained is by accessing data that is publicly available. Some of that data isn't necessarily open data, but it is publicly available. And we'll talk about that distinction in a little bit. But that has paved the way for innovation in terms of the advancement of those technologies. Also, to better understand the potential markets and customers. So looking at doing research using the data that's publicly available to gain a better understanding of maybe ideas of how the penetrating different markets with those ideas. And then efficiency. It's less costly now to discover and access data because of the internet. And by making it more available and having more of a standard approach to that availability could lead to even greater efficiencies for access and use. There are several, types of data sources that include public data, through public data repositories or standalone public data. There's also licensed data and synthetic data. And I'll explain the distinction between these various types here in the next upcoming slides. So public data, what is public data? So public data is data that's just freely available on the internet. Now, it might be freely available on the internet, but it may not be readily accessible. So the format of the data can be widespread, and it's oftentimes very, very messy. And there may be restrictions on the use. So this is where there might be data that you can view online, but there are restrictions in terms of the end user agreements that might restrict how you can use and distribute that data. Examples of that might be data that's accessed on like Indeed.com. You can go and see get information about all these different job postings that are out there. However, there's restrictions on how you can use that data. You can't just take the data that's on Indeed.com and create your own job search tool. That would be a violation of their user agreement. Facebook, there's a lot of data that's online on Facebook that is public. At least some of it is public, but there's restrictions on how you can use that data. So public data, again, it's out there. It's free to access, but maybe not distribute in terms of its distribution and use. There might be restrictions. The distinction between public data and open data is data that's freely available and can be readily accessed, used, reused, and redistributed, and sometimes even redistributed in a way that it can be sold. So this is data that's readily accessible. Oftentimes it's managed by government agencies, federal agencies, and there are no restrictions on use. The format can often tends to be a bit more structured and usable because it's stored in these repositories that you have kind of one place to go to get access to a lot of the data sources. Examples of this data include things like data.gov or data.cms.gov. So public data, it can be open, but that isn't always the case. So a lot of public data is also open data, but a lot of public data is also restricted in terms of its access and use. Now, the open data movement, really, it started with President Bush. So President Bush signed the Openness Promotes Effectiveness in Our National Government Act of 2007. And the idea of open data really gained attention around 2008. And the internet helped to popularize the concept. And the government, the federal government agencies, launched what is now known today as the Open Government Initiative that kind of blew this concept up. Despite this, starting way back in 2007, there's actually very little growth that has happened in the last 10 plus years regarding the open data movement. There have been updates in terms of the open data platforms and initiatives, yet it's not necessarily gained widespread attention, and access is still of a big a challenge. And also the oversight regarding these open data initiatives is not well regulated. Originally, federal agencies were required to publish at least 2 important data sets a year to the public through data.gov. And that initially sparked this really widespread participation. However, there were no consequences of federal agencies if they didn't access or publish data on data.gov. So it's the movement to overarching adoption of an open data movement has really been stalled, and there hasn't been a lot of further development in that space. Now, there are initiatives around data modernization through CMS and other agencies, CDC, that are resulting in more players joining the game regarding making data accessible and usable in a format for others across the healthcare arena to be able to access and use data. But those initiatives are just starting even in the last few years. So I do think it's an area to pay attention to for further development. So in 2009, the day Barack Obama was sworn into office, he signed a memorandum for transparency and open government. Part of that was the accelerating this open government, this data, a public data initiative. In 2012, the Health Data Consortium was developed to oversee this health data initiative to accelerate the availability and use of health data. And that's what healthdata.gov was really adopted. And then in 2014, by that time, healthdata.gov resulted in about 2,000 important data sets being published online. In 2017, there's about 3,000 data sets that were published up to that point. In 2019, January of 2019, the Foundation for Evidence-Based Policymaking Act was published, and that included the Open Government Data Act that was signed into law that did outline some regulations of like consequences if federal agencies didn't necessarily participate. Those consequences really haven't been realized, though. In 2020, the Open Government Partnership developed a platform for information and data sharing to help fight the spread of COVID-19. COVID-19 kind of disrupted and derailed a lot of that Open Government Data Act because a lot of attention then was focused on public awareness regarding COVID-19. In 2022, the fifth National Action Plan for the Open Government was drawn together, outlining steps that were needed to address inclusive, responsive, and transparent accountability for federal agencies. That expires in 2024 in terms of this national plan. And it's intended to outline further goals and initiatives for adopting more, having federal agencies adopt these practices to publish more data. I haven't seen anything coming out recently since 2022 regarding this. So there is a bit of a stall. A lot of the more recent developments have been related to more data modernization and democratizing data where you have private entities that are getting into this space. Oftentimes the data that's publicly available is published in data repositories. This data so in the healthcare domain, we have healthdata.gov. That is a popular one-stop shop in terms of a data repository. And how that data is published is you have metadata that describes the data set. So an example would be the title of the data. It would be keywords that describe the data. It would be information about the publisher, like who is the federal agency that is publishing that data. And then the websites, how they work, like healthdata.gov and data.gov, which are examples of these repositories, there's a search interface that allows you to search by keywords or topic, or you can even just look at the most widely used data sets, the more popular data sets. And then what is provided along with these data sets is oftentimes access to the actual data sets or an access to the URL, which sends you to the actual web page for where the downloadable data can be accessed and used. So here's an example. This is data that I just pulled down. It's one of the more popular data sets that are published on healthdata.gov. And this is for child fatalities by submission type. And so this is data that's published by the National Child Abuse and Neglect Data System. And you can see that the U.S. Department of Health and Human Services manages this data. And the data, in terms of when you access the downloadable file, it can be downloaded in a number of different ways. So you can download it as a text file. So if you export the data, you can download it as a text file, a CSV file, which looks like something on the left, or you can download it as a JSON file that would include information in a format that's shown on the right. So there's different options in terms of how you export that data. Healthdata.gov, data.gov, they have APIs that allow you to gain access to a lot of this data. So if you are a programmer or developer, you can actually pair up with these data repositories to be able to utilize that data in different ways. So that is just an example of one of those data sets in terms of how that metadata is published. But there's a lot of challenges with the metadata that's published and accessed and how that data is stored on those data repositories. So partly, you're trying to grapple with this data avalanche of all of this data that's out there, and we're struggling. We're struggling because the metadata is often fraught with issues related to accuracy, where the metadata that's being published on these websites aren't fully representative of the actual data set that they're trying to share and disseminate. And there's a lack of consistency. So one federal agency might publish a lot of more verbose information that describes a data set, but another federal agency might lack in terms of how they're providing the type of information. So they might not even include like the date in terms of the last time the data was updated. Or they might just publish a URL for gaining access to that data, but they might not link to the actual like data file. So that's an example. The completeness, there's a lot of gaps in terms of that metadata that's available. The currentness, so these data repositories, part of the open government initiative was to have federal agencies update these data sets on an annual basis at least. Well, a lot of these data repositories, you will see data that's published that's accessible from years and years and years ago. And just knowing, having knowledge about the data that's published and available by these agencies, that is not the most recent and up-to-date data that you can gain access to. And then accessibility. Sometimes the data is published in a way that isn't the most user-friendly. How do we use JSON? How do we use XML? How do we use a .dat file? Those can result in some challenges if you are skilled in terms of how to use that data. That can inhibit use. So I want to spend a little bit of time talking about public data schemas before I get into more examples of public data that you can access and use. So there's this great initiative called the semantic web, that it was this idea where we create this connected online environment where we have websites that connect to other websites and we can link data. So this idea regarding the semantic web is this infrastructure, this system of connectedness. It's the web of data, truly a web of data where things are connected. And a good analogy of it is this. So if the current web, think about it as like the current internet of web is like a library where we have books, which are like web pages, and they're organized so that you can find them, right? So you can go and you can find these websites and you can access it, and there's a catalog of websites. The semantic web is like having a librarian who knows every book's content and can recommend exactly what you need, right? That's not really how the internet is constructed right now. It takes a lot of discovery, a lot of searching to find what you need. We have search engines that try their best to have a catalog, an index of that data that's available, but even that falls short with knowing and gaining access to that data. So think about the problem with gaining access to public data or open data. If I want to access that data, I have to really know what I'm looking for and search these search engines, or go to data.gov or healthdata.gov, or go directly to the data publisher to really know what I want to gain access to. And if you don't have that knowledge, or you're just trying to get a general understanding, what data is out there in a particular topic, that's going to be very, very difficult to actually get what you want, even if it's out there for waiting to be discovered. So the semantic web, it can be applied to public data sources on the internet to enhance data sharing, interoperability, and usability. And there's a lot of hope and desire for this semantic web to create more opportunities for integrating data sources, improving search and discovery by annotating and creating more sophisticated search engines that can understand the context of user queries, so that you can actually get like these ontologies, that when you find this thing, you're going to find related content and concepts. More interoperability. So the semantic web uses standards like Resource Description Framework, otherwise known as RDF, or Sparkle, which is a query language, to ensure that data from different sources can work together. And this would be crucial for like government agencies that can actually allow the public to collaborate and share data across different systems, but that's really not happening. And then open data initiatives, like I've already talked about, enhancing public services and helping with policy making and governance so we can gain access to the tools that we need, even by our federal agencies lack access to the data that they need to make decisions. So in essence, applying the semantic web to public data sources can make data more usable and actionable, not just for humans, but for automated systems that serve us. However, the semantic web is largely dead. So despite its widespread like hope for this interconnected internet that allows us to access data, the semantic web is dead. This broad vision for the internet where data is structured in such a way that it can be read and understood by machines and not just humans, it's kind of a pipe dream. It's something that we hope for that probably will never happen. So this then walks in knowledge graphs. It's a specific type of database that uses graph structures with nodes, edges, and properties that is intended to provide a conceptual framework or ontology for how we understand and access data, not just public and data online, but any sort of data. It can be used to actually implement the semantic web concepts because it's designed to handle interconnected data in complex queries. So knowledge graphs, they have become popular in recent years because they provide a practical way to handle complex data and have more widely adopted, data integration, searches, and analyses. But they're still gaining traction. I'm going to provide you with an example. So here's an example so you have nodes, which nodes are kind of the building blocks of the graphs. They represent what we consider as entities in a traditional relational database. So they might be things like people, places, objects, situations, or concepts. Then you have the edges. The edges are the connections between those nodes. And the properties are the attributes or characteristics assigned to those nodes. So here's an example. Eiffel Tower. Eiffel Tower is a node that might have its own properties, right? It might have properties regarding its latitude and longitude. And its address is a property. And the Eiffel Tower, though, has edges where it's located in Paris. Paris is a city, so Paris is a node that has an edge, is a relationship because it's a city. A city is a node. So this is an example of a knowledge graph that can allow us to represent the relationship between location, between attractions based off of location, between people that might be interested in those attractions. So like Bob is a person. Bob is a friend to Alice, and Alice visited the Eiffel Tower. You can see the expansion of these knowledge graphs that allow us to gain more connections between disparate data that otherwise wouldn't be connected. Bob historically, but Bob may not have any connection to the Eiffel Tower other than being a person and being connected to Alice. So this is how we can gain more interconnected access to public data. And this is just starting to happen. So we have companies that are emerging that are creating these knowledge graphs that are allowing greater access and connectiveness of these public data sources. In healthcare, knowledge graphs are gaining some traction. You see a lot of things happening in the in the healthcare space, where there's more attention being around using these knowledge graphs to kind of understand how data is connected that's housed within a healthcare entity. So thinking about a hospital or a public health organization, or even a lot of that work is happening in like genomics and proteomics and thinking about patient phenotyping. So here's an example of knowledge graphs in healthcare and how they're like the different examples of how they're being used. In population health management, So population level data is being aggregated from electronic health records, social determinants, environmental factors, and thinking about how the flow of that information within a population and representing those populations at different points of whether they're at a hospital or you're looking at vital health statistic data within a county, and how that connects to data that might be connected to the US Census. And looking at the connections between those data can create a lot of really rich information about need. What are the major needs of the people within a population, and how can we address those needs? Other examples of how you can apply knowledge graphs in open source data is it can create connections between data that otherwise wouldn't have any connections, or that it would be really difficult to create connections in the traditional sense of the data that is could be published in relational databases. So think about entities, just something as simple as place. You might have state represented as, let's say California. Well, California might have a connection to a different city, or that California as a state could be represented by FIPS codes, different codes that represent geography. There's relationship between those different entities in different ways. Los Angeles is part of California. The zip code of 90001 is located in Los Angeles. And then you have properties for those different entities and maybe the different relationships. So a population is the number of people living in a particular area. Well, what is the population of California? What is the population of Los Angeles? What is the population of a zip code? You have the area, which represents the land area, of like the density of the population, or even the boundaries of that geospatial area. Latitude and longitude give you the geographic coordinates for a precise location that could be aligned with those different entities. So that's how knowledge graphs in open source data as a very high level example can be used. All right, now let's get into the meat of public data sources and different examples of different public data, despite the limitations in terms of the frameworks that are available for disseminating and publishing data. I'm going to share with you a bunch of different resources that you can utilize to get access to the public data sources. And we're going to start with public data repositories. So a public data repository is, a collection of data sets. And some examples of these include data.gov. Data.gov being, an initiative by the federal government through the Open Data Initiative. That's really where it started. And underneath that is healthdata.gov, which is considered a community site of data.gov, which is just specific to health related data. Now, there's a lot of data that can be accessed on these data sets, on these data repositories. But again, recall some of the limitations. Some of it may not be the most recent. There might be some incomplete and gaps in terms of how that data, can be like the information that describes these data sets. And still, sometimes the data is published in a way that it's not the most user-friendly. So it might be published in a file format that really isn't the easiest to use. Other examples that you may not be aware of, Google Dataset Search. Google Dataset Search is something that was in a beta phase it's, I think, still in beta phase. And it provides like a search engine to be able to access data. And that is available online. And they use like close to Google's own like schema format for how you can search and retrieve that data. CMS Data Navigator is an example of a lot of the data that is accessed, available through the Centers for Medicare and Medicaid. CDC Wonder is another example of a data repository through CDC. AWS Data Exchange allows you to actually use an API and to load data directly into Amazon servers if you are like managing an S3 server, and you can actually analyze and use the data using the AWS products. So data providers can actually publish their data on this data exchange for access and use. GitHub has a forum where developers can share software and code with other developers, and many times they make data sets available in GitHub. Harvard Dataverse is another example that you can access over 140,000 data sets related to a number of research fields that allow researchers to share, archive, cite, and access and explore research data sets. And it's a voluntary project for researchers to collaborate and share their data. So I would encourage you to check out some of these as examples of data repositories. Now, the acquisition of the data for these public repositories, often it's user submitted. So healthdata.gov, data.gov, the Harvard Dataverse would be examples where they ask people or agencies, representatives or employees of those agencies to publish that data. And the pros of doing it that way is it includes a lot of data, but the cons are it's difficult to find what you're looking for if it's user submitted, because it's at the mercy of whoever is typing in the metadata to describe that data to get how complete they are being. So there might be limited scope in terms of what you can find of user submitted data. And also we oftentimes find that in the user submitted data, it can be out of date. Otherwise, you have web crawlers. So like Google Dataset Search, it includes a lot of data. But again, the problem is it can be difficult to find what you're looking for. And also the format can be widespread. And sometimes that data can be out of date as well. And then you have data that's just originates from its site. It's just published on a website. You go there, you access it, you download it. Examples would be the county health rankings data. That I think it's updated every quarter. The data is up to date, which is great, but the cons, it's not an exhaustive or comprehensive data set. It often requires data to be merged with other data sets to become of greater use. So they might be limited in terms of scope. There's also standalone data sets. So these are data sets that are maintained by an entity or a publisher, and it's made available on their website. So that's I'll show you some examples here in a moment, but county health rankings is one of those. Now, these data sets are often discoverable on data repositories. So if you go to data.gov or the Google Dataset search, you might find them there. But you can also just find them by going directly to those websites. So the issue with the standalone data sets, more often you'll gain access to the more popular data sets because they'll be indexed and shown at the top of the results in terms of when you're searching for things. But those that are less popular are going to be kind of hidden. They're not going to be as easy to find and retrieve. So some examples of the standalone data sets include IPUMS. This provides census and survey data from around the world, and it's integrated across time and space. So one data set in particular that I use is the Integrated Health Inventory Series, the IHIS data set, that includes individual level responses and household responses on a number of health related survey questions. But it also includes a lot of data that can be accessed free of charge. County health rankings data is a great data set to use for population health and public health initiatives. The Compare websites, Hospital Compare, Provider Compare, Home Health Compare, Nursing Home Compare are all published there, and you can gain organization level statistics. Dartmouth Atlas has a number of data sets regarding hospital and county level financial data that would be useful. CDC Places has a number of data sets that would be useful. CMS payment data public use file includes information on inpatient, outpatient, Part D, drug, durable medical equipment, a number of different data that is aggregated by provider or whatnot that can be useful. And there's state websites that like the Minnesota Department of Health or the Minnesota Demographer. There's data that's published on their websites regarding population level statistics that could be very useful. Okay, license data is another subset of data. This is data that requires a subscription or a payment to access. So it might be public data, but it's restricted, right? You might still have to pay to gain access. Or they might have some of their data that's available, just that's open, but otherwise to gain or you might just have like the data in aggregate form accessible. But to gain full access to the raw data, you have to pay. So this is often requires a data use agreement that specifies the limitations of the use and distribution of the data. And oftentimes, if you're going to use that data, you have to have appropriate attribution. And some of the data sets also require training. So you have to undergo their training in order to even get access. The data can be expensive to gain access to some of the data. So it depends on the source as well. Examples include HCUP. So this HCUP does have access to some reports that you can get free, but if you want access to the raw data, you need a data use agreement, user training, and a payment is required. But the data includes a lot of information on inpatient, emergency departments, ambulatory visits. There's data on children as well. The database does have information around healthcare utilization, access, charges, the quality of care, outcomes. There's a lot of great data out there. OPPS claims data is data on outpatient prospective payment system. It includes diagnostic data, provider information, procedural information, and cost data that's included at an organizational level. You have Healthcare Cost Institute, you have the NCQA data, and then lastly, and as an example, is this N2C2. It's a natural language processing research data sets that through a data use agreement, you can gain access to them. And they're fully de-identified clinical notes for research and training purposes that can be used. And then we have synthetic data. Synthetic data is an interesting type of data that's artificial. It's not real data, but it's realistic looking. And this is oftentimes where you have these algorithms that were developed to create artificial data that looks like real data so that it can be used for research purposes, for educational studies, for even software developers to do testing. And oftentimes the access to those tools, it's free. So examples include SynPuff, so the synthetic public use file data. This is synthetic fake claims data that includes inpatient, outpatient, carrier claims data, beneficiary information, and prescription drug events. And it's intended to be used for training purposes or for developers to gain access to what claims data would look like if they want to gain access to real claims data. And there's millions and millions and millions of rows of data that you can download and use. Cynthia is a tool that was developed by the MITRE group that is synthetic population level health data that includes complete medical history, diagnostic information. You can even gain access to medical notes. And it's intended to be used for training, tech development, and research. And it's a really interesting and fun tool to use if you're looking for like fake and realistic data. The problem with it is it tends to come with it's too clean of data. So if you're trying to gain a very realistic experience of using healthcare data, it might be a little too clean for widespread use. There's also simulations, and this is where you can create custom scenarios and testing on a fake population. And a really cool example of this is the islands. I encourage you to visit this website if you want to learn more about this project, but this is where there's a virtual human population that's been developed, and you can learn and like do experimental designs and epidemiology like experiments on a population, and you can you can even give certain members of the population a drug, and you can monitor the effects of that drug over a period of years versus another part of the population that maybe isn't using that drug. You can see what happens to that population over time. So it's a simulation that's really kind of neat to use. So some considerations when you're working with any of this data is the format of the data. The format can vary. It can be a text file, a CSV file, an SPSS, SAS, R, DAT, JSON, XML, many different formats that the data can be published. But the data, sometimes depending on your familiarity with that different format or the type of software you have access to, there might be limits in terms of what you can do with that data. So you might need a text reader to open a file or specific software. Examples might be Notepad++ or Text Wrangler to actually just view the data. You may need to parse the data programmatically as well to make any sense of the data. And sometimes the data is just too large to access with certain tools. That gets us into other considerations. So if you're dealing with a data set that's like more than 1 million rows of data, you may not be able to open it in a tool like Microsoft Excel. So you might have to use other tools that you might have access to. Examples might be like R or Python. The age of the data, sometimes that data is outdated, and sometimes it's updated very frequently. So depending on the challenge, that the data is just frequently updated. Well, do you have the most up-to-date data set? Like if you're using Hospital Compare or County Health Rankings, you might complete a project with that data, and then all of a sudden a new version of it is published. So what do you do with that? Other considerations is the level of the data. Thinking about the geographic setting, many data sets are aggregated by county or state. Is that a granular enough view? Or there is data that's published at the hospital level, or many data sets publish hospital level statistics and outcomes, or patient level, where you're finding that the patient level data, it's a challenge to find and use. Well, a lot of public data can't publish just patient level data because of HIPAA, and that would potentially violate HIPAA if you can see actual protected health information about patients. So this is where you might have to use geographic reference files to connect data sets and to make sense of the geographic boundaries that are available in that data. So examples of geographic reference files include like USDA rural urban commuting areas, or RUCA codes that can classify US Census tracts into different, like urban clusters. There's also core-based statistical areas. There's Tiger line files, US Census relationship files. These files become very useful if you want to connect data that's at different geographic levels. So how do I connect state to county? How do I connect county to zip code? How do I connect that to FIPS code? All those connections can make sense by using these relationship files. And then you can create things like geospatial maps, like are shown on the screen here. So what can you do with public data? I'm going to soar through this, but there's a lot of things you can do. You can do research. You can do a lot of different types of analyses, including development of like AI and machine learning algorithms. You could do product development, testing a concept of a new product using like artificial data or synthetic data. Strategic planning, or you can utilize, or creating new initiatives around population level data and doing program evaluation. So here are some examples of using public data in different ways. So here's an example of using public data for research. So this was a study that was published in 2021 where they used MedPAR and Hospital Compare and data from the American Medical Association. And they used this data to determine whether patient to nurse staffing ratios were appropriate with in the relationship with various clinical outcomes. And so they use this public data to make some recommendations on how to staff nursing, and also implementing that staffing, what it should be relative to sepsis protocols for improving sepsis patient outcomes. So that's one example of how public data was used in research. And I've done quite a bit of research using public data as well. It's a underutilized and great resource to really look at many different important topics that could be discovered and explored further, where you have statistical modeling with these public data sources that are available. Other examples would be, here's another example of a study that was published in 2019 using IPUMS and the NHIS data set, where they made a recommendation where for medical schools that they should consider improving pipelines for getting diverse healthcare professionals and increasing efforts to eliminate structural racism that is persistent in healthcare delivery systems. They created this recommendation by analyzing data that's publicly available. Here's an initiative that myself and a colleague of mine, Brandon Olson, who's on the call here, where we created a public data population health toolkit that is fully based off of public data and open data, using data sets like Hospital Compare, county health rankings. And the whole idea behind this is to make data that's available to educate people on how to do, analysis of population of public health data. And there's dashboards that we generated and created based off these public tools and data. So I encourage you to visit that and get a better sense of what we're trying to do with that data set. But there's a number of scenarios where you can utilize that data, become more familiar with how to analyze data using a dashboard. There's also public data that's available for benchmarking. So if you go to Hospital Compare, and if you've never been there, I encourage you to do so. It's a tool that's intended to be used by the general public to make more informed decisions about the quality of care and the type of care that's available by different hospitals. So here's an example of looking like at Essentia versus St. Luke's versus Community Memorial, which is located in Cloquet, Minnesota, and comparing the patient survey results that are part of HCAHPS surveys, which are inpatient stays after an inpatient stay, patients or their family members can fill out these patient surveys. But you can get information about patient surveys, about how well people felt the communication was within these various hospitals. So that's just an example of one small use case of a type of data that can be accessed, and other hospitals can use that for benchmarking their performance based off of the performance of other hospitals. There's also public data that can be used for policy. So this is an example of county health rankings, and you can evaluate current state and historical trends that could be used for creating public intervention and lobbying for change through legislative or policy changes, and collaborating with colleagues and public agencies to say, this is important, this is something we need to have greater more initiatives around. So here's an example of using the county health rankings and looking at different data in St. Louis County, and seeing that in St. Louis County, the percentage of adults reporting binge or heavy drinking is higher compared to many counties in Minnesota. You can also look at public data for consumers. So here's an example of using the Medicare Part D prescriber lookup tool, where you could actually look up a specific provider and see what their prescribing behavior is. How many of a particular, what are the top drugs prescribed by a provider, the number of refills, the number of days they supplied, and the total cost. And this is where consumers can get estimates of whether a provider is more likely to prescribe a generic medication, and that could save them money. So this is an underutilized tool that is accessed and can be used by the general public. So in conclusion, there are a number of open and public data repositories or data sets that are accessible to all. The metadata quality for how these are published and the metadata that describes the data sets really remains an issue. However, the data is out there. You just got to find it. There are more initiatives that are being developed to put more structure around these data sets, to make them more user-friendly and available for specific types of providers or data consumers. There's also a lot of geographic data that can be used to summarize places when working with public data sources. And really, there's opportunity for everyone to gain be more participatory in terms of how you're using public data. You can use it as a consumer. You can use it as a leader, a healthcare leader, or a leader in other organizations, as a researcher or as a policymaker. Really, it's endless in terms of how that data can be used. If you have any questions you'd like to ask me, feel free to reach out. You also can follow me on LinkedIn. I'm on there, and reach out to me, but feel free to reach out to me on email as well. And I can share these slides with Eric and Joe to share with the recording, but I have links to all these data sets that I've shared as well. So if you'd like to review that on your own time. And I do see there's a question here, which I can answer. So I know sometimes the question is, I know sometimes pulling data from data repositories is difficult to work with, as it isn't clear exactly what the data is in each column and what that data actually means. So what suggestions do you have to address that? All right. Oftentimes you have to go to the actually where the data is published and read the data dictionary. And even then, the question may not be addressed. Here's an example of a challenge of a data source. So I was recently looking at data that was published on suicide rates, but there were two different data sets that were publishing that suicide rates in different ways. One was the suicide rate for the where the suicide that occurred, so where the county where the suicide occurred, and another was publishing suicide rates for the geographic setting where the person resided, where they lived. So those are two very different types of metrics. And until you go to the actual data dictionary and review that data and the definition of that data, what is the numerator, what is the denominator, what are the inclusion exclusion criteria, there might be gaps in terms of what that data is actually inferring. So it's very important that once you get down to that column, what is the definition of that column, that you go to the actual source of the data. Those data repositories oftentimes will not be good enough. They will not display that level of detail. Sometimes they do, but oftentimes you need to go to the actual data website to get that information. Are there other questions? And I'll put my contact information on the slide again. All right, well, if there aren't further questions, I do encourage you all to get out there and try to use a data source and see what you can do with it. I think that there's a lot of power to be had with information, and it's just waiting out there to be had.
Thank you again, David. Like I said, we'll make sure that we follow up with some information, including the slides and recording from today, and appreciate everyone attending.